worry about the destination. Enjoy the journey. And the more you enjoy the journey, the more are the chances that you will keep walking. And if you keep walking, who can stop you from reaching your destination? Yes, to reach the destination, only two things are required. First, your route should be correct. The path on which you're walking should be correct. And second, you should not stop. You should keep walking. If anybody has to reach the Everest top, how much time does he spend there? Maybe a few minutes, maybe a few hours, clicks a few pictures and then back again. So if we did not enjoy the journey of so many days of toiling together, would it be worth? No. So yes, nothing is worth if you do not enjoy this journey. Put happiness into it, put love into it. Always remember, why are you doing it? What is your purpose? You have a great responsibility on your shoulders. Enjoy this journey. Love it. So with this, we start with the anatomy of the middle ear. Now, before we start with the anatomy of the middle ear, let me first give you a basic orientation about the middle ear. Now, the middle ear is a 6-box cavity. Like suppose this room, it has got a roof, it has got a floor, it has got, suppose if I'm talking about my right ear, it has an anterior wall, it has a posterior wall, it has a lateral wall, and it has a medial wall, right? Now, when we go from the external auditory canal, when we go medially, we enter into the middle ear, which means that between the external auditory canal and the middle ear, there is a common wall. Yes, can you tell me what that common wall is? Yes, very good. That is the tympanic membrane. So, the tympanic membrane which will form which wall of the middle ear? Yes, it will form the lateral wall of the middle ear. Now, from the middle ear, when we further go medially inside, yes, we go into the inner ear, which means that between the middle ear and the inner ear, we again have a common wall. Yes, what wall of the middle ear will that be? Yes, that will be the medial wall of the middle ear. So, if I have to go from the middle ear into the inner ear, I will have to go through which wall? Yes, the medial wall. If I have to go from the external auditory canal into the middle ear, I will have to go through which wall? Yes, the lateral wall. So, in between the middle ear and the pharynx, also we have a wall. Yes, what wall is that? That is anterior. Pharynx is anterior to the middle ear, so that is the anterior wall of the middle ear. Now, do you know of any structure which connects the middle ear to the pharynx? Yes, we know that. What is that? Yes, the eustachian tube. Now, simply if I ask you, eustachian tube is on which wall of middle ear? Correct. Yes, the anterior wall. Now, if I tell you that there is a nerve that passes through the middle ear and then it comes to supply the tongue. So, can you tell me which nerve is that? We'll see that later on. You just tell me now that if this nerve is coming from the middle ear to supply the tongue, it will pass through which wall of the middle ear? It will exit the middle ear through which wall of the middle ear? Yes, very good. That is the anterior wall. Okay, now which is the common wall between the middle ear and the mastoid? Posterior to the middle ear is the mastoid. So, which will be the common wall between the middle ear and the mastoid? Yes, that will be the posterior wall. Now, whenever we remove diseases from the middle ear and the mastoid, we first remove the disease from the mastoid. So, we have removed the disease from the mastoid. Now, from the mastoid, we want to come into the middle ear. Which wall? Through which wall will we come from the mastoid into the middle ear? Yes, through the posterior wall. In other words, if I ask you which is the most important wall for us in mastoid surgeries? Yes, very good. That is the posterior wall. So, with this orientation, we will start with the walls of the middle ear. Now, the lateral wall of the middle ear, that is the tympanic membrane, we have done in great detail in the last module. So, what you're going to tell me is all that you already know about the tympanic membrane. Yes, the tympanic membrane develops from all the 3 layers. How many layers does it have? Yes, it has 3 layers. Yes. So, you are going to tell me, I'm just going to write. How many layers? Yes, 3 layers. What's the color? Yes, it is pearly white. Or it is pearly grey. And is it translucent? Yes, it is translucent. What's the angle of the tympanic membrane with the horizontal? Yes, quickly. Yes, it is 55 degrees. What else is 55 degrees on the tympanic membrane? Effective vibratory tympanic membrane surface area. What is the normal anatomical surface area? It is 90 millimeters square. But the effective vibratory surface area is 55 millimeters square. What is the thickness? Yes, we know that the length is 10, breadth is 9 and the thickness is 0.1 millimeters. What is umbo? Yes, where the tympanic membrane attaches to the tip of handle of malleus. Tip of handle of malleus. Where is cone of flight? Cone of flight is in which quadrant? Which quadrant? Yes, very good. The anteroinferior quadrant. What is the most mobile part of tympanic membrane overall? Pars tensa or pars flaccida? Yes, it is the pars flaccida. Which is the more mobile part of pars tensa? Yes, pars tensa is the center or the periphery if I ask you. Yes, it is the periphery. But if I ask you that overall, it becomes the paramedian. So it is the paramedian, or we can call it as the periphery. Periphery. Yes, will you be able to identify which side of the tympanic membrane it is, which tympanic membrane it is, whether it is the right ear or the left ear, yes or no? What do you have to look at? Yes, we have to look at the upper end of the malleus. So if the upper end is facing towards the right, this is the right tympanic membrane. If it is facing towards the left, it is the left tympanic membrane. And also if it is facing towards the right, which part of the middle ear is that? Which part of the tympanic membrane is that? Is this the anterior or the posterior part? Yes, that is the anterior part. So that is all that we needed to know in the tympanic membrane, and I hope that before I wrote all this, you were telling me the answer. Yes or no? Very good. So now coming to the medial wall of the middle ear. The medial wall is the common wall between middle ear and inner ear. So all the structures that are present on the medial wall are usually produced by inner ear structures. And inner ear we know very nicely. Yes or no? Yes, you have seen the module before. Always I have told you, go in the sequence in which the lecture has been taken, the modules are presented, because that is how you have to do it. So yes, the medial wall, on the medial wall will be all the structures that are projecting from the inner ear on the medial wall. So what are the structures? Let us quickly have a look. So here we have the medial wall. Now on the medial wall in the center is a bulge that is produced by the basal turn of the cochlea, and this is what is known as promontory. Promontory. This is produced by basal turn of cochlea. Yes, can you tell me basal turn senses what sounds? High frequency or low frequency sounds? Yes, basal turn is for high frequency sounds. Low frequency, I asked you to remember it like, yes, in the apex there is less space, so that is for low frequency. So this is basal turn. And this we have seen many a times, but yes, our eyes will see only what our minds know. So let us see now this. Yes, we have seen this. This here is the basal turn. Here is the basal turn of the cochlea. Yes, and that is producing a bulge on the medial wall. This is what is known as the promontory. Now here posterior-superiorly, so this is the posterior part and this is the anterior part. So posteriorly and superiorly, here we have a opening, a window on which is present the footplate of stapes. So quickly tell me, what window is this? Yes, this is the oval window. This is the oval window. Now below this is another window, and this is what is the round window. Yes, now if I pass this pen through the oval window, where in the inner ear is it going to go? Yes, vestibule, scala vestibuli, scala tympani, where? Yes, it is vestibule. How do we remember that? V for oval, V for vestibule. Yes, V of the oval tells us it is going into V of vestibule, and vestibule is around. Yes, utricle and saccule. Now, if I pass this pen through the round window, where in the inner ear is it going? Yes, round window is covered by secondary tympanic membrane. That gives the name scala tympani. Now, I have to pass the electrodes of cochlear implant into the inner ear. Which window should we choose? Tell me, you tell me, which window should I pass the electrodes of cochlear implant? Excellent, the round window, the round window. Now here, just above the oval window, we have a bulge that is produced by some semicircular canal. Can you guess which semicircular canal will that be? Yes, the semicircular canals have been named according to the direction they are going into. Superior is superior, lateral is lateral, posterior is posterior. So tell me, which one is this? What lies medial to the middle ear? Inner ear. What lies lateral to the inner ear? Middle ear. So if some semicircular canal is going towards the middle ear, it is going in which direction? Lateral. So which semicircular canal will that be? Yes, that will be the lateral semicircular canal. And when we know this, can you answer this question for me? Which is the semicircular canal which is eroded most commonly following diseases of middle ear? Very good, the lateral semicircular canal. If we put different temperatures of water in the external auditory canal, we can stimulate the inner ear. We can induce convection currents in the inner ear, we can stimulate the inner ear. So if we are doing this, which semicircular canal are we stimulating? Yes, the lateral semicircular canal. And this what we do by putting different temperatures of water in the ear. This is known as Calbric test. We will do that in detail later on. And there you are going to tell me when I ask you that the Calbric test stimulates which semicircular canal. Yes, which semicircular canal? The lateral semicircular canal. Yes, because the bulge of lateral semicircular canal is present on which wall of the middle ear? Yes, the medial wall. Above the oval window? Below the oval window? Yes, it is above the oval window. So what are we seeing here? Notice this. Yes, there are so many important things on the posterior part of the medial wall. Yes, so the posterior part of the medial wall is a very, very important area. And always remember, wherever you are seeing the semicircular canals, what is the name of the semicircular canals? So the names are the lateral, the posterior. Why the posterior is known as posterior? Because it faces posteriorly. It faces posteriorly. What posteriorly? The mastoid, the one that faces the mastoid, when one that is closest to the mastoid is known as posterior semicircular canal. So wherever you are seeing the bulges of the semicircular canals, that is always the posterior part of the middle ear. Is that very clear? Okay, now in the anterior part of the medial wall superiorly, we have a projection of bone coming from the medial wall, from the cochlea. This is what is known as processus cochleariformis. So if somebody will ask you, processus cochleariformis is on which wall? Anything that has some relation to the cochlea, some relation to the inner ear, has to be on the medial wall of the middle ear. So yes, this will be on which wall? The medial wall. Now this processus cochleariformis is important to us for two reasons. The first reason is that one of the muscle of the middle ear, which is named as tensor tympani. The name itself tells you tensor tympani means it is tensing the tympanic membrane. But yes, we saw that tympanic membrane, on the tympanic membrane, there is no muscle attached. So how is it tensing the tympanic membrane? It is not attaching to the tympanic membrane. It is attaching to the ossicle that attaches to the tympanic membrane. Which ossicle is that? Yes, that is the malleus. So this tensor tympani has to attach on the malleus. From where is this tensor tympani arising? It arises from the anterior wall. So if I am talking about my right ear, this is the anterior wall. So from the, suppose this is the right ear, this is the right ear cavity. This is the anterior wall. So from the anterior wall arises the tensor tympani muscle, and it has to go to attach to the malleus. Just below the neck of the malleus, at the upper end of the handle of malleus, attaches the tensor tympani. This is the tympanic membrane, there is the lateral wall. Yes, on that is attached the malleus. So from anterior wall, the tensor tympani has to go to attach to the malleus. But it will not go slanting like this. How does it go? It goes first medially towards the medial wall, where is the processus cochleariformis present, and there it winds around the processus cochleariformis, and then it goes straight to attach to the upper end of the handle of malleus, so that when it exerts the pull is in a straight line, the pull is more proper. And when it exerts the pull, what will happen? Yes, it will pull the tympanic membrane medially, it will retract the tympanic membrane, it will tense the tympanic membrane, that will stiffen the ossicular chain. Stiffening of ossicular chain, what will that lead to? Yes, that will lead to the hindrance of transmission of sound. We want to increase the transmission of sound, no? Why do we want to hinder it? Why do we want to decrease the transmission of sound? Yes, the tensor tympani, always remember, tensor tympani is supplied by the same nerve that supplies the muscles of mastication. Which nerve is that? Yes, the mandibular nerve. So whenever the muscles of mastication are getting activated, which means that whenever we are chewing, this tensor tympani gets activated. It retracts the tympanic membrane, tenses the tympanic membrane, stiffens the ossicular chain, so that this sound of chewing is not transmitted so much into the ear. Yes, so whenever we are chewing, do you feel that, oh my God, so much of sound of movement of the jaw, so much of sound of crushing of the teeth, of the food with the teeth, all that we are hearing, it is too much of a disturbance. Some people notice it. Yes, in whom the tensor tympani is not functioning, in whom the mandibular nerve is not functioning. So that is the function of tensor tympani. And what does this processus cochleariformis do? The processus cochleariformis is the area where the tensor tympani tendon winds around to take a lateral turn. Now when I say that the tensor tympani winds around the process cochleoformis, always remember it winds around. If it is asked that tensor tympani attaches to, don't mark the answer as process cochleoformis. It does not attach to the process cochleoformis. Where does it attach to? It attaches to the handle of malleus, the upper end of the handle of malleus. Is that clear? So this is one significance of the processus cochleariformis. The first significance is that the tensor tympani tendon winds around it. To turn laterally. Now, the second significance of this processus cochleariformis is that this acts as a landmark for the facial nerve. Where is the facial nerve? Have you heard of the facial nerve earlier also in the year? Yes, we have. We know that the facial nerve enters the ear and then comes to the face. So quickly tell me, the facial nerve exits the cranium and it enters the inner ear through which foramen? Yes, through the internal acoustic meatus. So now it has come into the inner ear. Okay. So now from the inner ear, it will come into the middle ear. So if something comes from the inner ear into the middle ear, it is but understood that it will come on which wall? Yes, on the medial wall. So after passing through the inner ear, the facial nerve takes a turn. This turn is known as the genuofacial, and now it runs horizontally on the medial wall. And this segment of the facial nerve running horizontally on the medial wall, this is what is known as the horizontal segment of facial nerve. Horizontal, also known as the tympanic segment of facial nerve. And yes, it is asked in your exam. Tympanic segment of facial nerve is present on which wall of the middle ear? On which wall? Yes, it is present on the medial wall. I told you that process cochleariformis is significant in relation to the facial nerve. It is a landmark for the facial nerve. So now you have raised the tympanic membrane and you are seeing this process cochleariformis. Tell me, where will you find the facial nerve? Superior to it, inferior to it? Very good, you will find it superior to it. So just superior to the process cochleariformis is the first genu. It is the first genu, and at the first genu is also present the geniculate ganglion. The geniculate ganglion. In other words, if I tell you that the process cochleariformis is a landmark for geniculate ganglion, will that be true? Yes, that is where we look for when we are looking for the geniculate ganglion. Now, I have told you one landmark for the facial nerve. You are going to tell me two more landmarks of the tympanic segment of facial nerve. Quickly tell me. Yes, I have told you one, that is process cochleariformis. I know you are very intelligent. Tell me two more. Tell me two more. Quickly. Yes. Yes, very good. The oval window. Where does the facial nerve lie? In relation to the oval window, the stapes footplate is present on the oval window that we cannot miss seeing when we are operating on the middle ear. So where we are likely to find the facial nerve in relation to the oval window? Superior to it, inferior to it? Yes, superior to it. And where is it in relation to the bulge of the lateral semicircular canal? Yes, inferior to it. So these are the three very, very important landmarks of the tympanic segment of facial nerve. So the second significance of process cochleariformis is that it is a landmark for facial nerve. Landmark for facial nerve. Yes, so we have three landmarks of facial nerve. We have three landmarks. One is the processus cochleariformis. Second is the oval window. And the third is the bulge of the lateral semicircular canal of facial nerve. Which part of the facial nerve are we talking about? The tympanic segment. Tympanic segment. So these are the structures that we need to know on the medial wall. Here you have the picture of the inner ear, and yes, you've seen this so many number of times. So I will draw the medial wall of the middle ear. Yes, so this is the medial wall of the middle ear, and this medial wall of the middle ear acts as a window to the inner ear. So there's all the projections of the inner ear structures on this medial wall. Let us see. Yes, here we have the bulge of the basal term of the cochlea. There's the promontory. Here we have the oval window. We have the round window. And this is the bulge of the lateral semicircular canal that we are seeing. Yes. How do we identify the semicircular canals? Which one is lateral, which one is posterior, which one is superior? I hope you already remember. Still, I will repeat it for you. Whenever the semicircular canals are given, how do we know which one is which one? Yes, we know that the common crus is present in between the superior and the posterior. So this is the common crus that we are seeing. One of them is superior, one of them is posterior. Which one will be the posterior? Yes, the one that will be in close relation to the lateral. That will be the posterior semicircular canal. Always remember. Yes, so this is the posterior semicircular canal, this is the superior semicircular canal, and here this is the lateral semicircular canal. So where is the facial nerve here? Yes, the facial nerve will pass in between these two, and here we will have the processus cochleariformis. Is that clear? So we see that we already knew everything about the medial wall of the middle ear. Now, this was an endoscopic picture that was given to you in your exam and was marked 1 and 2. Yes, identify them. So, how do we identify? Yes, first we are going to see that which ear it is. Which ear is this? Yes, this is the right ear. And which is the anterior part? So, this is the anterior part. So this is the anterior part. So we know that the structures that are marked is in the center and it is in the posterior part. So now we do not have to think so much. So we know this is going to be in the center is going to be the promontory. And what is 2? 2 is some opening that is present in the posterior part but inferiorly. So which window does it have to be? This has to be the round window. Are you very, very sure that this is a round window? Think again. Is it not the oval window? Are you very sure? Of course, we can see that this here window has the stapes on it, has some ossicle on it. So, which window has that to be? That one has to be the oval window. So, this one is going to be the round window. Is that very clear? So, when you know this tympanic membrane, now how to find out which part of the middle ear it is, it becomes so simple and so quick. So, now quickly keep your pens down. Tensor tympani attaches to process cochleariformis. True, false? Yes, no? What? No, false. It attaches to where? Yes, it attaches to the handle of malleus, the upper end. Yes, quickly tell me, what are the landmarks of the tympanic segment of the facial nerve? Yes, very good. Process cochleariformis, oval window, round window also? No? No. Okay, lateral semicircular canal. Where is the facial nerve in relation to the oval window? Superior to it, inferior to it? Yes, it is superior to it. Where is the facial nerve in relation to the lateral semicircular canal? Superior, inferior? Yes, it is inferior. The promontory is produced by the apical turn of the cochlea. True, false? Promontory by the basal turn of the cochlea. Erosion of which semicircular canal is seen most commonly in disease of middle ear? Yes, the lateral semicircular canal. Semicircular canal can be stimulated by Calvert test? The lateral semicircular canal. I am not writing down all these things here. Why? Because these clinical things we are going to do in great detail later on. But I am combining it here so that you exactly know, and when we do those things, you are going to answer all this for me. So that is what you need to know in the anatomy of the medial wall. So now starting with the anatomy of the posterior wall of the middle ear. First tell me, posterior wall is the common wall between, yes, middle ear and mastoid. Yes, so here we have the medial wall of the middle ear, and this here is the posterior wall of the middle ear, and this is the common wall between the middle ear and the mastoid. And on this posterior wall is the opening that connects the uppermost part of the middle ear cavity to the mastoid antrum. We know what's the mastoid antrum? Yes, that is the largest mastoid air cell. And this connection is what is known as additus. This is known as additus. So the additus connects the attic. What is attic? Attic is the uppermost part of the middle ear cavity, also known as epitympanum. It connects the epitympanum or the uppermost part of the middle ear cavity to the mastoid antrum. Now we saw that the facial nerve was coming from the inner ear, taking a turn, and then it was running horizontally on the medial wall. Now, at the junction of the medial and the posterior wall, the facial nerve takes another turn. And now the facial nerve runs vertically down. This segment of the facial nerve is what is known as the vertical segment. This is known as the vertical segment also known as the mastoid segment. Why is it known as the mastoid segment? We can see because this is present on the common wall between the middle ear and the mastoid. Now, if I ask you that which is the segment of the facial nerve which will be injured most commonly during mastoid surgeries? Yes, which segment of facial nerve? Yes, the mastoid segment. Now, the facial nerve comes down and it exits through the stylomastoid foramen. Now, it divides into the 5 branches which supply the muscles of the face. Now, just before exiting, the facial nerve gives a branch. This is what is known as chorda tympani. This is the chorda tympani. What does the chorda tympani supply? Chorda tympani supplies? Yes, anterior 2/3 of the tongue. Does it give taste or does it give sensation? Yes, it is for taste. Taste to which part of the tongue? Yes, anterior 2/3 of the tongue. So, which means that we have the stylomastoid foramen here, and just before that is the chorda tympani given. It has to come to supply the tongue. So, does it from here not come like this to supply the tongue? No, it doesn't. It first ascends up. It enters the middle ear through an opening here on the posterior wall. So, this is the opening for the entry of chorda tympani. And then it passes through the middle ear between the malleus and the incus, just above the attachment of the tensor tympani, where the tensor tympani attaches on the handle of malleus. Just above that, this nerve passes from posterior to the anterior wall, and then it exits through the anterior wall to go and give taste to the anterior 2/3 of the tongue. So, what we are seeing is the posterior wall now. So, we are concentrating on the entry of the chorda tympani. So, this here is the entry of the chorda tympani, and this entry of chorda tympani, do you know, it is through the tympanic membrane. Where the tympanic membrane, where I told you this is the tympanic membrane. So, where the tympanic membrane, the posterior part attaches, yes, in between the fibrous and the mucosal layer. Tympanic membrane has 3 layers. Yes, this is the epithelial layer, outer layer. In between is the fibrous layer, which forms the annulus here, and then medial is the mucosal layer. Yes, so in between the fibrous and in between the mucosal layer, there is the opening on the posterior wall for the entry of the chorda tympani. Now here on the posterior wall, superiorly we have a fossa. This fossa is known as fossa incudis. Fossa incudis. Does the name tell you something? Fossa incudis. Incudis means it is produced by the incus. So yes, this fossa is produced by the short process of incus. So before we proceed, let us see quickly how the ossicles are and what their processes are so that we understand what we are doing now. So these here are the 3 ossicles. This is the first ossicle. This is the malleus. The malleus has a head, so it will have a neck also. Whenever there is a head, there is a neck. So malleus has a head. This part is what is known as the head of malleus. So this is the neck of the malleus. This is the neck of the malleus, and then it has this long handle. This is known as the handle of malleus. This is known as the handle. And we know that the malleus has 2 processes. One that projects towards the external auditory canal, which is tightly attached on the tympanic membrane, like a projection on the tympanic membrane. What is that known as? That is known as the lateral process. And one process projects anteriorly. If I'm talking about the right ear, this is the anterior. Anteriorly, that is what is this one. This is what is the anterior process of malleus. Now, attached to the malleus is the incus. Incus does not have any head, so obviously it will not have any neck. It directly has a body. Yes, so this is the body of the incus, and incus has 2 processes. One is small, it is known as the short process, and the other one is what is known as long process. The long process ends below into a process which is known as the lenticular process. Lenticular process, which articulates with the head of the stapes. Now, the largest ossicle, just see here and tell me, which one do you think? Malleus or incus? It is incus. Incus is the largest ossicle. And then we have the stapes. The stapes has a head again. So, which means that malleus also has head and stapes also has head. And whenever there will be head, there will be neck also. So, here also stapes has a head. It has a neck. This is the neck. And it has 2 crura, anterior crura. This is the posterior crura, and this here is the footplate of the stapes. So we know what the parts of the ossicles are. Now here in between the ossicles are attached to each other. So in between them are joints. What is the joint? This joint that you are seeing in between the malleus and incus. You see and you tell me. Yes? Yes, this is the saddle joint. Saddle. What is the joint between the incus and the stapes? Yes, this is a ball and socket joint. ball and socket joint. Now, if I ask you that which of the ossicles are present in vertical orientation, so if you are raising the tympanic membrane and you are seeing some ossicles which are present vertically like this, so which will be these ossicles? Yes, the malleus and incus, both of them are present in the vertical orientation, whereas stapes, just see here, stapes is present in the horizontal orientation. So we have the malleus and incus which are vertical, and stapes will be present like this. Stapes will be present like this. It will be present in the horizontal orientation. So now coming back to this diagram here of the posterior wall. So here I told you that we have a fossa that is produced by the short process of incus. So how is it? It is like here we have this is, I told you, suppose this is the right middle ear. This is the anterior wall, this is the posterior wall, this is the lateral wall. So on the lateral wall, there's a tympanic membrane is attached to the malleus, and then we have the incus. So incus has a long process which goes to attach to the stapes head, and it has a short process. Short process projects on which wall? On the posterior wall. So where it projects on the posterior wall, there it produces a depression. This depression is what is known as a fossa produced by incus or fossa incudis. Now this is a very, very important area of the posterior wall. Why? Because this is the boundary of one of the most important areas on the posterior wall where we operate. So see carefully, what we are coming to now is a very common area that is asked in your exam. So this area, can you see this area? This area in between, medially the facial nerve, the vertical segment of facial nerve, laterally the chorda tympani, and superiorly the fossa incudis. This is the extremely important area on the posterior wall, and this is what is known as the facial recess area. First, quickly let us write down the boundaries of the facial recess area, and then we will see the significance of the facial recess area. So the facial recess, yes, tell me quickly, what are the boundaries? The boundaries are the medial boundary is the vertical segment of facial nerve, vertical facial. The lateral boundary is the chorda tympani, and the superior boundary is the fossa incudis. That is clear now, yes? Now, what is the significance of this area? Now, just answer this question. The electrodes of the cochlear implant are passed from the middle ear into the inner ear through. You have to pass the electrodes from the middle ear into the inner ear. Which window? Yes, round window. Now, I change this question. The electrodes of cochlear implant are passed from the mastoid into the middle ear through. So, what we do is we first place the electrodes of cochlear implant in the mastoid, and then from the mastoid we pass it into the middle ear, and then from the middle ear into the inner ear. So now I'm not asking you how you're passing it into the inner ear. I'm asking you how are you passing it from the mastoid into the middle ear. That has to be through the common wall. That's the posterior wall. So where on the posterior wall will you make an opening to pass the electrodes from the mastoid into the middle ear? Yes, that will be in the facial recess area. Also, whenever we have to remove diseases from the middle ear and mastoid, what we do is we first operate the mastoid. So we have drilled the mastoid, we have removed all the disease from the mastoid, and what we saw is that the disease is very limited in the mastoid. So now, considering that the disease in the middle ear is also going to be very limited, we just make a small opening on the posterior wall to remove the limited disease of the middle ear. So if we have to make an opening to remove the disease from the middle ear through the mastoid, if we want to come into the middle ear to remove the disease, from which wall? Yes, the posterior wall. And where on the posterior wall are we going to make the opening? Yes, that's the facial recess area. So that is the significance of the facial recess area. Its use is first in mastoid surgeries. In mastoid surgeries, what surgery is it? That we will see later on. This surgery is known as making a OMI. OMI means opening. Making a opening on the posterior wall to come into the tympanic cavity. This is known as posterior tympanotomy. Tympanotomy means making an opening, OMI, or in the tympanic cavity on the posterior wall. So posterior tympanotomy. What is the site of posterior tympanotomy? The facial recess area. And the second significance is that the electrodes of cochlear implant are passed into the middle ear. I think this is one of the most common area of the posterior wall that is asked in your exam. Into the middle ear. Have been asked so many number of times. See, the pictures are given, operative pictures, surgical pictures, and we will see that in some time, how they look like. Or just questions are given that while operating, while entering the middle ear through the facial recess area, there are chances of injury to the vertical segment of facial, the horizontal segment of facial, the chorda tympani, dislocation of ossicles, all except which will not be injured. Yes, which will not be injured. Answer. Yes, it is the horizontal segment which will not be injured. That is not a boundary of the facial recess area. Where is the horizontal segment or the tympanic segment of the facial nerve? On which wall? On the medial wall. We are making facial recess approach, or we are entering through the facial recess. That is on which wall? The posterior wall. Again has been asked, while doing posterior tympanotomy, there are chances of injury to which of these following structures? Again, the choices were the same, but the question that was being asked, instead of asking approaching through the facial recess, what was asked now was while doing posterior tympanotomy. Now tell me, you have raised the tympanic membrane. Yes. So will you see the facial nerve in the middle ear? Of course, we will see. What are the segments of the facial nerve that you will see? Yes, we will see the horizontal segment of the facial nerve on the medial wall, and we will see the vertical segment of the facial nerve on which wall? On the posterior wall. Very good. So, which means that when you raise the tympanic membrane, you will see the horizontal segment of the facial nerve and the vertical segment of the facial nerve going like a whitish nerve horizontally and vertically. Yes or no? No. What? No. You will not see the facial nerve running as a whitish nerve. Then facial nerve is the only cranial nerve that has got a very long bony canal. In fact, in whole of the temporal bone, when I say temporal bone, what do I mean? The ear. In fact, in whole of the ear, the moment it enters the ear through the internal acoustic meatus, still it exists from the stylomastoid foramen. In whole of the ear, it is protected in a bony canal, and this bony canal is known as fallopian canal. Fallopian. Yes, we have heard it, no? Fallopian tubes. That we never forget. And this we never remember. This is fallopian canal. Now, never forget that. Yes, this is fallopian canal. So, what you see running horizontally and vertically is not the whitish nerve. What you see is the bulge of the fallopian canal going horizontally and going vertically. Thankfully. Why? Because middle ear, see, it is so accessible. Middle ear infections can occur through the eustachian tube also. Common cold, any pharyngitis, that can lead to infections of middle ear. And had it been lying there exposed, can you imagine facial nerve palsy would have been so common? So it lies protected in a bony canal. Okay, so which means that what you're seeing here vertically is like a pillar, a bony canal like a pillar. So if this is the posterior wall, yes, this is the right ear we're talking about. This is the posterior wall. So here we have the tympanic membrane here. Yes, here is the medial wall. This pillar that you are seeing going vertically down on the posterior wall, this is the vertical segment of the facial nerve. So here we have the tympanic membrane. Here is the opening of the chorda tympani. The chorda tympani is entering here. So lateral to this vertical segment, in between the vertical segment and the chorda tympani, this area is the facial recess area. Yes, and just medial to it, just medial to this pillar, this area, yes, where I am putting the pen. Can you see the pen? You cannot? Of course, you will not be able to see. Why? Because this is hidden behind this pillar. So yes, this area which is medial to the pillar, hidden behind the pillar, this is what is known as the hidden area of the middle ear. It is going like a sinus behind this pillar, so it is known as sinus tympani area, or the hidden area of the middle ear. And this is the most common site of residual disease. This is the most common site of recurrent disease, because if you're not very careful to remove disease from here, which disease? Cholesteatoma. What is cholesteatoma? That's a very important disease of middle ear. For now, just know that much. So that, if it is left behind, can be very hazardous. And this is the site where it is left behind most commonly. because this area is not very easily visible. This is known as the hidden area of the middle ear, which means that if this is the pillar of the facial nerve, the vertical segment of the facial nerve, just medial to it, this area is what is known as the sinus tympani, or it is known as the hidden area of middle ear. Hidden area. This is the most common site of residual. You are leaving behind disease here, so that will lead to recurrence of disease, residual or recurrence of disease. And whenever we say sinus tympani, to localize exactly where the sinus tympani is, or the hidden area of the middle ear is, there are two landmarks. Yes, just see this. Here in the center we have the promontory, we know that. Now from the promontory arise two crest of bones which go superiorly and which go inferiorly, like this. So this sinus tympani area happens to lie in between these two crest of bone. And what are the names of these two crest of bone? The upper crest of bone has been named as ponticulus, and the lower crest of bone has been named as what is known as subiculum. The ponticulus and the subiculum. And when we were learning this, our teacher told us to remember it as Polis station. So that is how I remember it till date. Polis station. Ponticulus is superior, P, and S is inferior, subiculum. So ponticulus and subiculum. So in between that is the sinus tympani area. Let me quickly make a cleaner diagram for you so that some new things we can add in new diagram. And now before that, you are going to help me. Yes, I am going to draw and you are going to quickly tell me what are these parts. Yes, what is this that I am drawing? Yes, what is this? Yes, the facial nerve. Which segment is this? Yes, the vertical segment. Yes, quickly. Tell me what is this? This is the opening for chorda tympani, entry or exit? Yes, that's the entry. And what is this? This is the fossa produced by incus fossa incursus. What is this area? This is the facial recess area. What is this? This opening here, this opening. This, what is that known as? Yes, that is known as additus. Yes, what is this area which is hidden medial to the bulge of the vertical segment? This is the sinus tympani area. Yes. Now coming to another important part on the posterior wall. Here on the posterior wall we have a pyramid shaped bone. This is shape of the pyramid, so it is known as pyramid. This is known as pyramid. And what is the significance of the pyramid? From the pyramid arises the second muscle of the middle ear. If I say second muscle, it means that we have the first muscle. First muscle, why? Because I have already told you that. What is that? Yes, that is the tensor tympani. Did we do the tensor tympani? Did I tell you that it rises from the anterior wall? It has to attach to the malleus, but it takes a turn at the process cochleoformis on the medial wall and then it goes to attach to the malleus? Yes. So now this second muscle is what is known as stapedius. This is known as stapedius, and why it is known as stapedius? Because it attaches to the neck of stapes. This muscle is what is known as stapedius. What does it do? It attaches to the neck of stapes. So what will happen when it will contract? Yes, the stapes will be pulled back. So when the stapes is pulled back from the oval window, what will happen? It will again decrease the transmission of sound into the inner ear. So again, it will protect the inner ear from noise trauma. So this stapedius protects the inner ear from noise trauma through a reflex which is known as stapedial reflex. Stapedial reflex. The detail about stapedial reflex we will see later on. But for now, I just want to ask you, stapedial reflex is mediated by which muscle? Yes, the stapedius muscle. Tell me, stapedius muscle will be supplied by which nerve? Because I also told you the tensor tympani is supplied by which nerve? Yes, the tensor tympani is supplied by the same as the muscles of mastication. That is the mandibular nerve. The stapedius will be supplied by? Yeah, just behind that is the facial. So that gives branches to the stapedius. So this mediates the stapedial reflex. And this stapedial reflex is mediated by only 7th nerve or 8th and 7th nerve. Think and tell me. Yes, it is 8th and 7th nerve. Yes, details we'll see later. But for now, just see if there's a very loud sound. It is picked up by the pinna. Yes, it goes into the middle ear, and then from the middle ear it goes into the inner ear, for it reaches the inner ear. It is picked up by the auditory pathway. The auditory pathway then senses that this is a very loud sound and it will damage the inner ear. It is now that the auditory pathway sends impulses to the facial. And now the impulses come down through the facial, supply the stapedius contracts and pulls the stapes back. So the afferent is the 8th nerve, efferent is the 7th nerve. It is not supplied only by the 7th. The stapedius is supplied by the 7th, but the stapedial reflex is not mediated only by the 7th. Stapedial reflex is mediated by both the 8th, that is the afferent, and the 7th, which is the efferent. So stapedial reflex, it has afferent, that is the auditory pathway, that is the 8th nerve, and the efferent, that is the 7th nerve. So we are slowly building the concepts now itself when we are doing the anatomy part. So this is what we need to know on the posterior wall. So now quickly keep your pens down. Yes. Now tell me quickly, the horizontal segment of the facial nerve is on which wall of the middle ear? Horizontal segment, medial wall. The vertical segment, posterior wall. Which is the segment of the facial nerve which is injured most commonly in mastoid surgeries? The vertical segment. Which semicircular canal erosion is seen most commonly in diseases of the middle ear? Lateral semicircular canal. Bulge of lateral semicircular canal is on which wall? Medial wall. Above the facial nerve, below the facial nerve? It is present above the facial nerve. Where is the oval window in relation to the lateral semicircular canal? Above the lateral semicircular canal, below it? Yes, it is below it. What is present on the oval window? The footprint of stapes. On the neck of stapes is attached. Stapedius arises from pyramid. Pyramid is present on which wall? Pyramid is present on the posterior wall. Yes, what is the facial recess area? Facial recess area bounded by. Yes, tell me quickly, what is the lateral boundary? Lateral is chorda tympani. Entry or exit? Entry. Medial is facial nerve. Which segment of facial nerve? The vertical segment. Superiorly is, yes, fossa incudis. Fossa incudis. What is present on the fossa incudis? Which process of incus? The short process of incus. Which process of incus articulates with the stapes? Yes, the long process, or exactly you can say that is the lenticular process. What is the joint between the malleus and the incus? Saddle. In between the incus and the stapes. Yes, that is the ball and socket joint. Which is the ossicle which is present in the horizontal orientation? Yes, that is the stapes. Why it is important, you will see when we see the endoscopic pictures. That is how you identify which ossicles are there. The electrodes of cochlear implant are introduced into the middle ear through the facial recess. What is the hidden area of the middle ear? Hidden area. Sinus tympani. Sinus tympani is present lateral to the vertical segment or medial to the vertical segment? Medial to the vertical segment. It is present on the posterior wall or it is present on the medial wall? This is something that you asked me. It is present on the posterior wall, it is present on the medial wall. It is present on the posterior wall, medial to the vertical segment. So it is present towards the medial wall of the middle ear, but it is not present on the medial wall. Where is it present? It is present on the posterior wall. It is bounded by two crests of bone. What are these two crests of bone known as? Superiorly is ponticulus, inferiorly is subiculum. Coming from the promontory. Promontory is produced by basal turn of cochlea. Basal turn of cochlea senses what sounds? Yes, the high frequency sounds. The high frequency sounds. When you want to remove the disease from the middle ear through the mastoid, you enter the middle ear through which area? Facial recess area. Can any infection from the middle ear go into the mastoid? From the middle ear, can any infection go to the mastoid? Yes or no? Yes, it can go. It can go through, yes, through the additus. It can go through the additus. So why not, when you have to remove disease through the mastoid, from the middle ear you have to remove the disease, why not come through the additus? Naturally we have that opening. Why make a separate opening in the facial recess area? Chances of injury to the chorda tympani, to the facial nerve, to the ossicles, the fossa incudis, where the short process of incus is present. Why make a separate opening there? Why not just come through the additus? Yes, just see here. Now this here is the middle ear cavity that you are seeing. The uppermost part of the middle ear cavity, this is the epitympanum. Now, where is the additus present? It is present in the uppermost part of the posterior wall, which means if that is the posterior wall, on the top, in the uppermost part of the posterior wall, will be present the adytus. So here will be present the adytus somewhere on the posterior wall. Adytus will be present in the topmost part. Whereas when we have to remove the disease from this area, yes, can you come from here like this? Not possible. We will have to make an opening lower down. So then we make an opening lower down. That is why we make an opening where? In the facial recess area. Is that clear? Now just have a look at this diagram that we have made. Can you notice that the sinus tympani is present inferior to the pyramid and the facial recess is present superior to it. So that is why sinus tympani is also known as infrapyramidal recess. Sinus tympani is known as infrapyramidal recess. And facial recess is known as suprapyramidal recess. Suprapyramidal recess. So these are some other words which are used for the same things that you already know, the facial recess and the sinus tympani. Now before I proceed to show you the endoscopic pictures which are asked in your exams, I want you to be very crystal clear about when we talk about the facial recess, when we talk about the common wall between the middle ear and mastoid, what exactly it means, because this is going to stay with you throughout ENT. Whenever we are doing whatever diseases, whatever surgeries, you need to understand this very nicely. Now just have a look at this. This is my right ear. This is the right ear. This is we had the pinna here. The pinna we have removed anteriorly, anterior to the pinna. So here this is the pinna. Pinna we have removed anterior to the pinna. This is the opening of the external auditory canal. And here posteriorly, posterior to the pinna is the mastoid. So pinna I have removed. So you can see this now. So now what I am going to do is, I am going to drill this mastoid. I am going to drill this mastoid till I reach the medial most, that is the largest mastoid air cell, and that is known as mastoid antrum. So let me drill the mastoid. So now I have drilled the mastoid and I have reached the medial most wall of the mastoid, and that is the medial most wall of the mastoid antrum. I will not go further medially. If I go, I will enter into the posterior cranial fossa. We know that. We start drilling here. And deepest and the largest mastoid air cell is the mastoid antrum. So once we reach the mastoid antrum, we stop the surgery here. That is the medial most wall of the mastoid antrum. If I drill further, I will enter into the posterior cranial fossa. Now just see here and please try to understand all your concentration here. Now this consider as two halls separated by a wall in between. The anterior hall, this hall, is divided by a curtain into two rooms. The room that lies lateral to the curtain, I am naming it as external auditory canal. And the room that lies medial to the curtain, I will name it as middle ear. Is that clear? Now, what is the purpose of me showing you this? Yes, please note that this is the common wall. Common wall between what? Common wall between the laterally, yes. I can call it anteriorly, I can call it laterally. Yes, lateral will be more appropriate. Laterally, between the external auditory canal and the mastoid. Yes, and when I go medially, this is the common wall between the middle ear and the mastoid. Yes or no? So can we say that the posterior wall of the external auditory canal is the common wall between the external auditory canal and the mastoid? Yes. Also, can we say that the posterior wall of the middle ear is the common wall between the middle ear and the mastoid? Yes or no? Yes, we can say that. So this is what you get confused when I say that the common wall between the middle ear and the mastoid is the posterior wall of middle ear. Yes, we have studied that. We know that. But when I say that the common wall between the external auditory canal and the mastoid is the posterior wall of the external auditory canal, then you say, how come it was the common wall was shared only between the middle ear and the mastoid? From where did the external auditory canal come into the picture? Now can you understand? These are two halls. The anterior hall is again divided into two rooms by this curtain, and this curtain is what is called as tympanic membrane. So when we want to go from the external auditory canal into the middle ear, either we can make an opening on this curtain, opening on the tympanic membrane. Or what we can do is, when we do not want to damage the tympanic membrane, we can simply raise this curtain. Like this. Work on the middle ear and then place this curtain back. Yes, so when I show you the endoscopic anatomy of the middle ear, you will see this is how we are doing, and this is how we do many of the surgeries of the ear, where we do not want to damage the tympanic membrane. Now let me remove this curtain and have a look at the middle ear cavity. Now in the middle ear cavity, I want you to focus only on one thing that I have demonstrated here, because that is the one thing that is asked very, very commonly in your exam, and you need to understand this when an endoscopic picture is given. So here, this vertical white thing that you're seeing, that is the vertical segment of the facial nerve. And this brown thing that you're seeing, this is the chorda tympani. So where will be the facial recess? What am I trying to show you? I'm trying to show you the facial recess area. So whenever we have to, can you see the electrode of cochlear implant coming, the blue? Yes? Can you see that? Yes, just see here. So what I did is, I drilled the mastoid till I reached the medial most wall, that is the mastoid antrum. And now what I did is, after I opened the mastoid antrum, I reached the medial most wall of the mastoid antrum. Now what I did is, this here, this I can call as the anterior wall of the mastoid anterior wall, or I can call it as the posterior wall of the middle ear. On this, in between the facial nerve, the chorda tympani, I made an opening, and through which I have passed this electrodes of cochlear implant. Can you see this electrode, this blue thing? Yes, this has been passed from the mastoid into the middle ear. Can you see it coming through? That is what is the facial recess area. That is what is the posterior tympanotomy. So now that you have seen that schematic model, let me make you understand through this picture the same thing what we saw, and then I will show you the surgical pictures which are given in your exams. So here we have, this is the external auditory canal. This is the curtain that I told you. What is this curtain? This is the tympanic membrane, and medial to that curtain, this is the middle ear cavity, where you are seeing the ossicles. You are seeing the upper part of the ossicles, the malleus and the incus. Okay, now this is the common wall between these two halls. Which two halls? This is the posterior hall. This is the anterior hall. That is how I showed you in the model. The posterior hall is one single hall, that is called the mastoid, and the anterior hall is divided by the curtain into a lateral part which we call as the external auditory canal, and the medial room which is known as the middle ear. So what we have done here in this picture is, we have drilled this mastoid till we have reached the mastoid antrum. Yes, and what we are seeing here is, this is the common wall between the external auditory canal and the mastoid, common wall between the middle ear and the mastoid. So when we reach the posterior wall of the middle ear, so we can see the facial nerve vertical segment going down, and we can see the chorda tympani coming up like this. So this is the area. And superiorly we can see this incus. This is a short process. Short process is coming where? Towards which wall? Towards the posterior wall. And yes, this is the posterior wall. It produces the depression. What is that known as? That is known as the fossa incudis. So this area below the fossa incudis, laterally bounded by the chorda tympani and medially by the facial nerve descending segment. This is the facial recess area. Now whenever pictures are given to you, they are operative pictures, which means patient is lying down. So now when the patient is lying down, this is what you see. So whenever you are seeing a picture like this, first try to orient yourself. What is superior? What is inferior? What is anterior? What is posterior? Only then approach to the further details. So here, what is the posterior part? We can see that this is the sigmoid sinus. Sigmoid sinus is the posterior boundary of the mastoid. So this is posterior. Yes. Now here we are seeing which is superior and which is inferior. If this is posterior, we know this is the anterior. This is the anterior part of the mastoid. This is anterior part of mastoid, which coincides with the posterior wall of the middle ear. Posterior wall of middle ear is the anterior wall of the mastoid. Yes or no? Yes. So we have the posterior wall of the middle ear, or that is the anterior wall of the mastoid. Now what is superior and what is inferior? Yes, wherever we are seeing the semicircular canals, that is the superior part. Why? We know that one of the semicircular canal is known as superior semicircular canal, which bulges in the base of skull. on the anterior slant of the petrous bone. So that has to be towards the base of skull. And we have the mastoid tip, you can see here, that definitely has to be inferiorly. The tip of mastoid has to be inferiorly. So this is the superior part and this is the inferior part. Yes. So now what we are seeing here is that we have drilled the mastoid, we have reached the medialmost wall of the antrum, and now we are seeing the facial nerve descending part on the posterior wall of the middle ear. We are seeing the chorda tympani going like this. We are seeing, this is the short process of incus, that's the area of the fossa incutis, and this is the area of the facial recess area where we are going to make the opening, the facial recess area. Now here a close-up view of the facial recess area is given. Whenever it is given in surgical pictures also, the picture is like this. So what is this? The semicircular canals are telling you that you have reached the medialmost wall of the antrum. And now you can see this is the vertical segment of the facial nerve. This is the chorda tympani. So PL is the short process of incus. This is the fossa incutis. This part we leave behind. If we will drill this part also, then what will happen? The ossicle will get dislocated. So you have to be careful not to injure this part, and below that you make the A opening. This opening is what is known as the facial recess area, and through the facial recess area you can see the round window. Is the round window present in the posterior part of the medial wall? If I draw the medial wall, this is the promontory, this is the anterior part, this is the posterior part. I have drawn the oval window, the round window, the lateral semicircular canal. Yes, all that we know, all these structures are present in the posterior part of the medial wall. This is the medial wall of the middle ear. So this is present in the posterior part. So this is very close to the posterior wall. So when I'm making an opening on the posterior wall, I can very clearly see this round window, and now through this I can pass the electrodes of cochlear implant or remove the disease from the middle ear cavity. So this is the operative picture. So here this is the mastoid antrum. This is the external auditory canal. This is the common wall between the external auditory canal and the mastoid, and deeper between the middle ear and the mastoid. So we have reached the medialmost wall, that is the mastoid antrum, and here we can see this is the adytus, the natural opening between the mastoid antrum and the middle ear. So when I am seeing these ossicles here, the head of the ossicles, I know this is the superior part. This is the superior part. This is the inferior part. So here I am seeing the head of the ossicles. So this I am getting a glimpse of the short process of the incus. So I know that this area should not be damaged. This is the area of the fossa incutis. Below this we will make an opening here in the common wall between the middle ear and the mastoid, the posterior wall of the middle ear. Just see here we have made the opening through which we can see this is the round window, and here we can see the oval window. This was a picture that was given in your exam and was asked, this big opening was marked and was asked that what is this big opening? And the choices were facial recess, the choices were round window, oval window. Now, when these choices are given, you get a hint that this is of the ear, right? So don't panic. If you just know the concepts and you just keep your eyes open, you will be able to answer the question. So this is, and what is this? This is the facial recess, and this is the round window. This is the round window. Again was a similar picture like this given in your exam, and where you can see you can see some wire passing through this opening into another opening here, and again the small opening was marked and was asked what it is. So yes, that is the opening of the round window, and the big opening is the opening of the facial recess area. Now quickly have a look at this endoscopic picture. When we are seeing the stapes, this here we know is the stapes. This is the, so this will be the incus. So we can make out now the stapes is in the horizontal orientation. Here is the oval window. So below that this window will be the round window. Yes, have you identified this? And in the center this bulge is what is the promontory. This is the promontory. And I try to identify this pyramid like bulge. This is what is known as the pyramid, and from the pyramid is arising this muscle. What is this? The stapedius, attaching where? To the neck of the stapes. And just notice here from the promontory, can you see this? This is the upper crest of bone, and here this is the lower crest of bone which goes towards the posterior wall, and here in between these two areas, hidden behind the pillar of the vertical segment of the facial nerve, that is what is the sinus tympani area. Sinus tympani area. So this upper crest is what is known as the ponticulus, and the lower crest is what is known as subiculum. So I hope you've understood the posterior wall very, very clearly, and that was a lot of time that we took to do the posterior wall. But yes, as I told you, details matter. It is worth getting it right. So quickly put your pens down. Yes, tell me, vertical segment of the facial nerve is on which wall? Posterior wall. Horizontal segment? On the medial wall. What is the area through which you pass the electrodes of cochlear implant into the middle ear? Yes, the facial recess. What is the hidden area of the middle ear? Sinus tympani. The sinus tympani is the suprapyramidal recess. True, false? It is the infrapyramidal recess. What attaches the neck of stapes? Stapedius. Stapedius arises from pyramid. Pyramid is on which wall? Posterior wall. Stapedius is supplied by facial nerve. Quickly tell me the boundaries of the facial recess area. Boundaries of facial recess. Medial boundary is descending part of facial nerve. Lateral boundary is chorda tympani. So PLA is fossa incudis. Fossa incudis is produced by short process of incus. What is the connection between the middle ear and the mastoid? Natural connection. Adytus. Adytus is on which wall of the middle ear? On the posterior wall. On the posterior wall of the middle ear. So that is what we need to know on the posterior wall of the middle ear.